Welcome. Today we're diving into a topic that affects everyone at some point, infections. But not all infections are the same. Some are caused by bacteria while others are triggered by viruses. Understanding the difference is crucial for proper treatment and prevention. In this video, we'll break down the key differences between bacterial and viral infections, explore how you can identify them, and discuss why it matters for your health. Let's start by understanding what infections are and why distinguishing between types is so important. Bacteria are single-celled microorganisms found almost everywhere, from soil to water and even inside our bodies. While many bacteria are harmless or even beneficial, some can cause diseases. These harmful bacteria invade our bodies, multiply, and produce toxins that make us sick. Common bacterial infections include strep throat, urinary tract infections, and tuberculosis. It's important to note that antibiotics can treat most bacterial infections, but misuse can lead to resistance. Now, let's see how viruses differ from bacteria. Viruses are much smaller than bacteria and can't survive on their own. They need to invade living cells to reproduce. Once inside, viruses hijack the cell's machinery to make more copies of themselves, often destroying the host cell in the process. Viral infections include the common cold, flu, COVID-19, and chickenpox. Unlike bacteria, viruses don't respond to antibiotics. Instead, treatment focuses on relieving symptoms or using antiviral medications for certain infection. Let's compare these two types of infections side by side. Bacterial and viral infections may cause similar symptoms, but they're fundamentally different. Bacteria are living organisms that can survive independently, while viruses are non-living particles that require a host. Bacterial infections often respond to antibiotics, but viral infections do not. The way they spread, the diseases they cause, and the treatments available all differ. Understanding these differences helps you and your healthcare provider choose the right treatment and avoid unnecessary medications. Both bacterial and viral infections can spread in similar ways, through coughing, sneezing, touching contaminated surfaces, or close contact with an infected person. However, some infections are more contagious than others. For example, the flu virus spreads rapidly in crowded places, while certain bacterial infections may require direct contact. Good hygiene, like washing hands and covering your mouth when coughing, help prevent both types of infections. Next, let's look at common symptoms. Bacterial and viral infections often share similar symptoms, making it hard to tell them apart. Fever, fatigue, cough, and sore throat are common to both. Sometimes you might also experience headaches, body aches, or a runny nose. Because the symptoms overlap, it's important not to jump to conclusions about the cause. Instead, pay attention to specific details and consult a healthcare professional for an accurate diagnosis. Some signs point more toward a bacterial infection. For example, if your symptoms last longer than 10 days, worsen after initial improvement, or include a high fever, it could be bacterial. Pus, localized redness, or swelling are also clues. Strep throat, for instance, often causes severe throat pain and white patches. These details help doctors decide if antibiotics are needed. Let's see how viral infections differ in their presentation. Viral infections often start quickly and may cause widespread symptoms like runny nose, watery eyes, and body aches. They usually improve within a week or so. Unlike bacterial infections, viral illnesses rarely produce pus or localized swelling. Instead, you might notice fatigue, mild fever, and general discomfort. Colds and the flu are classic examples. Remember, antibiotics won't help with viral infections, so rest and fluids are key. Doctors use a combination of your symptoms, medical history, and sometimes lab tests to figure out if an infection is bacterial or viral. They may take a throat swab, blood sample, or urine test. Rapid tests can help identify strep throat or the flu. In some cases, imaging like X-rays is used to check for pneumonia. Accurate diagnosis ensures you get the right treatment and avoid unnecessary antibiotics. Antibiotics are powerful medicines designed to kill bacteria or stop them from multiplying. They're effective against bacterial infections like strep throat, some ear infections, and urinary tract infections. However, they don't work on viruses. Taking antibiotics for a viral infection won't help and can even cause harm by promoting antibiotic resistance. Always use antibiotics as prescribed by your doctor. For some viral infections, doctors may prescribe antiviral medications. These drugs don't kill viruses outright but help slow their growth and reduce symptoms. Antivirals are used for illnesses like influenza, HIV, and herpes. Not all viral infections need medication. Many, like the common cold, get better on their own with rest and fluids. Let's talk about prevention next. Prevention is always better than cure. Good hygiene is your first line of defense. Wash your hands regularly, avoid touching your face, and cover your mouth when sneezing or coughing. Vaccines are another powerful tool, especially against viral infections like measles, flu, and COVID-19. For bacterial infections, keeping wounds clean and practicing safe food handling are key. Let's look at some real-life examples. Strep throat is a classic bacterial infection caused by Streptococcus bacteria. It leads to a sore, scratchy throat, pain when swallowing, and sometimes fever. White patches may appear on the tonsils. Doctors diagnose it with a rapid strep test and treat it with antibiotics. Prompt treatment helps prevent complications and speeds up recovery. Common cold is a viral infection usually caused by rhinoviruses. Symptoms include a runny nose, sneezing, mild fever, and sore throat. There's no cure, but rest, fluids, and over-the-counter remedies can help you feel better. Antibiotics won't work, so focus on comfort and let your immune system do its job. Urinary tract infections, or UTIs, are usually caused by bacteria entering the urinary system. Symptoms include burning during urination, frequent urges to urinate, and lower abdominal pain. Doctors confirm the diagnosis with a urine test and prescribe antibiotics for treatment. Drinking plenty of water can help flush out bacteria and speed recovery. Influenza, or the flu, is a viral infection that spreads easily through droplets in the air. Symptoms include high fever, chills, body aches, and fatigue. Antiviral medications can help if started early, but most people recover with rest and fluids. Annual flu vaccines are the best way to prevent infection. Tuberculosis is a serious bacterial infection that mainly affects the lungs. It spreads through the air when an infected person coughs or sneezes. Symptoms include a persistent cough, weight loss, night sweats, and fever. Treatment involves a long course of antibiotics, and early detection is crucial for stopping its spread. COVID-19 is a viral infection caused by the coronavirus SARS-CoV-2. It can cause a wide range of symptoms from mild cough and fever to severe breathing difficulties. Some people lose their sense of taste or smell. Vaccines and antiviral medications are available, but prevention through hygiene and vaccination remains key. One of the biggest challenges in treating bacterial infections is antibiotic resistance. This happens when bacteria adapt and become immune to the effects of antibiotics. Overuse and misuse of antibiotics speed up this process, making infections harder to treat. Always follow your doctor's instructions and never share or save antibiotics for later. If you have symptoms that are severe, last longer than expected, or worsen over time, it's important to see a doctor. High fever, difficulty breathing, chest pain, or confusion are warning signs that need immediate attention. Early diagnosis and treatment can prevent complications and speed up recovery. Most viral infections, like the common cold or mild flu, can be managed at home. Rest, drink plenty of fluids, and use over-the-counter medications to relieve symptoms. Avoid unnecessary antibiotics as they won't help and could cause side effects. If symptoms worsen or you have underlying health conditions, consult your doctor. For bacterial infections, it's important to take the full course of antibiotics as prescribed, even if you start feeling better. This ensures all bacteria are eliminated and reduces the risk of resistance. Support your recovery with rest, hydration, and good nutrition. If you notice side effects or no improvement, contact your healthcare provider. Vaccines are one of the most effective ways to prevent viral infections like measles, mumps, flu, and COVID-19. Some vaccines also protect against bacterial diseases such as whooping cough and pneumonia. Vaccination not only protects you but also helps prevent the spread of disease in the community. Simple hygiene habits can go a long way in preventing both bacterial and viral infections. Wash your hands regularly, especially before eating and after using the restroom. Avoid close contact with sick individuals and disinfect frequently touched surfaces. These small steps make a big difference in staying healthy. Many bacterial infections are linked to contaminated food or water. Practice safe food handling by cooking meat thoroughly, washing fruits and vegetables, and keeping raw and cooked foods separate. Clean kitchen surfaces and utensils regularly. These habits help prevent foodborne illnesses and keep your family safe. Traveling can expose you to new bacteria and viruses. Before traveling, check if you need any vaccines or preventive medications. Practice good hygiene, drink safe water, and avoid risky foods. If you feel unwell after returning, see a doctor and mention your travel history for accurate diagnosis. Children are more susceptible to infections because their immune systems are still developing. Teach kids good hygiene, ensure they receive recommended vaccines, and keep them home when they're sick to prevent spreading illness. If your child has a high fever or trouble breathing, seek medical attention promptly. Older adults have weaker immune systems, making them more vulnerable to both bacterial and viral infections. Regular checkups, vaccinations, and prompt treatment of symptoms are important. Encourage good nutrition, physical activity, and social connections to support overall health and immunity. People with weakened immune systems due to conditions like HIV, cancer, or certain medications are at higher risk for severe infections. They should follow strict hygiene, avoid crowds during outbreaks, and stay up to date with vaccines. Early medical attention is crucial if symptoms develop. Chronic illnesses like diabetes, heart disease, or lung conditions can increase the risk of complications from infections. Manage your chronic conditions well, follow your treatment plan, and get recommended vaccines. If you develop symptoms of infection, contact your healthcare provider promptly. Your immune system is your body's defense against infections. It recognizes and attacks bacteria and viruses to keep you healthy. A strong immune system can often fight off mild infections without medication. Support your immunity with a balanced diet, regular exercise, enough sleep, and stress management. Many people believe antibiotics can cure any infection, but that's not true. Antibiotics only work against bacteria, not viruses. Another myth is that green mucus always means a bacterial infection, but it can occur with viral illnesses too. Understanding the facts helps you make better health decisions. For mild symptoms, over-the-counter medications like pain relievers, decongestants, or cough syrups can help you feel better. These don't cure the infection but can make you more comfortable while your body fights off the illness. Always follow the instructions and check with your doctor if you have questions. Some people turn to natural remedies like honey, ginger, or herbal teas for relief. While these can soothe symptoms, they don't replace medical treatment for serious infections. Always consult your doctor before trying new remedies, especially if you have underlying health conditions or take other medications. Rest is a powerful tool for recovery. When you're sick, your body needs extra energy to fight off infection. Take time off work or school, get plenty of sleep, and avoid strenuous activities. Listening to your body helps speed up healing and prevents spreading illness to others. Staying hydrated and eating nutritious foods support your immune system during illness. Drink water, clear broths, or herbal teas to replace fluids lost from fever or sweating. Choose easy-to-digest foods like fruits, vegetables, and whole grains. Good nutrition helps your body recover faster. Sometimes, infections can lead to complications like pneumonia, sinusitis, or sepsis. Warning signs include high fever, chest pain, shortness of breath, confusion, or severe weakness. If you notice these symptoms, seek medical attention right away. Early intervention can prevent serious outcomes. Doctors, nurses, and pharmacists play a key role in diagnosing and treating infections. They use their expertise to determine the cause, recommend the right treatment, and monitor your progress. Trust their advice and communicate openly about your symptoms and concerns for the best care. Infections don't just affect individuals, they can impact entire communities. Outbreaks of bacterial or viral diseases can strain healthcare systems and disrupt daily life. Vaccination, hygiene, and responsible use of antibiotics help protect everyone. Working together keeps our communities healthier and safer. Around the world, bacterial and viral infections remain major public health challenges. Diseases like tuberculosis, HIV, and influenza affect millions each year. International cooperation, research, and access to vaccines and medicines are essential for controlling infections and saving lives globally. Advances in science and technology are improving our ability to prevent, diagnose, and treat infections. Rapid tests, new vaccines, and better antibiotics are on the horizon. Public education and responsible health practices will remain vital as we face new challenges in infection control. To sum up, bacterial and viral infections have important differences in their causes, symptoms, and treatments. Knowing how to identify them helps you make better health choices and avoid unnecessary antibiotics. Practice good hygiene, get vaccinated, and consult your doctor when in doubt. Your actions protect not just yourself but your whole community. If you want to learn more about bacterial and viral infections, trusted sources include the Centers for Disease Control and Prevention (CDC), World Health Organization (WHO), and your local health department. These organizations offer up-to-date information, guidelines, and tips for staying healthy. Being informed is the first step to protecting your health. By understanding the differences between bacterial and viral infections, you can take the right actions when you or your loved ones get sick. Stay proactive, ask questions, and make choices that support your well-being. Thanks for joining us on this journey to understand bacterial and viral infections. Remember, knowledge is power when it comes to your health. Stay curious, stay cautious, and take care of yourself and those around you. With the right information and habits, you can help prevent infections and live a healthier life.